Hello everybody, welcome to my channel. And आज I'm पढ़ना चाहते हैं the effects of caffeine on our body. Many of us rely on a morning cup of a coffee or a jolt of coffee in the afternoon to help us get through the day. Caffeine is so widely available that the US Food and Drug Administration (FDA) says about 80% of US adults take some form of caffeine every day. But caffeine does so much more than just keeping you awake. It's our central nervous system stimulate the affects your body in numerous ways. Knowing the symptoms of caffeine and its long-term effect on your body make you think twice about having the fourth cup of coffee. Read on to learn more about these effects. Alert brain. The stimulating effect of caffeine causes alertness right away. It can also temporarily reveal downsidedness and fatigue. And another one is confusion. Uh, Too much caffeine can overstimulate the brain, leading to confusion. Another one is decreased suicide age. One study found that the mood enhancing effect of caffeine was linked to a 45% lower risk of suicide in participants. Another one is headaches. A headache can occur from either too much caffeine or as a symptom of caffeine withdrawal, but in small amounts it may relieve symptoms of hangover. Irritability. When your body is used to caffeine, you can experience irritability as a symptom of withdrawal. So these are the brain effects. Then now come to the lower part, that is mouth. Decreased risk of oral cancer. Drinking 4 or more 8-ounce cups of caffeinated coffee may lower your risk of oral and throat cancer. Now bottom, rapid heartbeat. Caffeine can cause a rapid heartbeat. This may be a concern if you have a pre-existing heart issue. You may notice arrhythmia whenever you have caffeine. Heartburn. The acidity of certain caffeinated products such as coffee and soda may cause heartburn. Muscle ache. Muscle ache could be a sign of caffeine withdrawal. Nausea and vomiting. Nausea and vomiting are symptoms of having too much caffeine. Diarrhea. Caffeine can help keep you regular, but too much can cause opposite effects like diarrhea. Fertility issue. Some women who consume too much caffeine might experience difficulties getting pregnant. If you are trying to get pregnant, it's best not to consume more than 300 milligram per day. Caffeine in the bones. Caffeine prevents calcium absorption in the bones, increasing your risk of osteoporosis. As you get older, your bones may break more easily. Pregnancy issue. Overconsumption of caffeine during pregnancy may cause miscarriage and developmental issue in newborns. It's recommended that women who are pregnant consume no more than 200 milligram of caffeine per day, which equals about 1 12-ounce cup of coffee. Increased urination. You may urinate more than when you have caffeine. Long-term use of high amounts of caffeine may increase bladder instability and worsen the risk for the already experiencing bladder problems. Increased blood pressure. Caffeine can temporarily raise your blood pressure. The effects may be especially noticeable if you have caffeine during or before right before exercise or other physical activities. Jitters. If you are not used to it, caffeine can give you the jitters. If you have an anxiety disorder or sleep disorder, caffeine may make it worse. Caffeine provides no nutritional value on its own. It's tasteless, so you won't necessarily know if it's in your food either. Even some medications may contain caffeine without your knowledge. This ingredient almost always causes some symptoms. At a minimum, you may feel more energetic, but over time, too much caffeine may cause withdrawal symptoms. According to the Mayo Clinic, it's safe for most healthy adults to consume up to 400 milligrams of caffeine per day. Keep in mind that a standard size cup of coffee is 8 ounce. If you are using a mug or getting your fix at a coffee house, chances are you are drinking 16 ounces or more. So reading labels is important. As you consume the same amount of caffeine on a daily basis, your body develops a tolerance to it. Other factors like your age, body mass, and overall health can determine your tolerance to caffeine too. If you want to decrease the amount of caffeine you take, it's best to decrease your consumption slowly. Central nervous system. Caffeine acts as a central nervous system stimulate when it reaches your brain. The most noticeable effect is alertness. You feel more awake and less tired, so it's a common ingredient in medications to treat or manage drowsiness, headaches, and mm, migraines. Studies have also found that people who drink coffee regularly have a lower risk of developing Alzheimer's and dementia and cuts risks by 45%. These benefits are limited to people who drink high octane coffee, not decaf. Some people consider coffee to be a healthy drink, but like most foods, over including can cause side effects. For example, too much caffeine can give you headaches. This is primarily linked to caffeine withdrawal. The blood vessels in your brain become used to caffeine effects. So if you suddenly stop consuming caffeine, it can cause a headache. Other symptoms of caffeine withdrawal include anxiety, irritability, drowsiness. In some people, sudden withdrawal may cause tremors. Although it's extremely rare, it's also possible to overdose on caffeine. Symptoms of an overdose include confusion, hallucinations, vomiting, and overdose can result in death due to convulsions. Overdosing happens by consuming large amount of caffeine, most often in energy drinks or diet pills. Up to 400 milligrams of caffeine is considered to be safe according to the Mayo Clinic. This equals about 4 cups of coffee. Although the amount of caffeine in beverages varies widely, digestive and excretory system. Caffeine increases the amount of acid in your stomach and may cause heartburn or upset stomach. Extra caffeine does not get stored in your body either. It's proceed in the liver and exits through your urine. This is why you might have an increase in urination shortly after having coffee. If you have experienced stomach problems like acid reflux or ulcers, ask your doctor if it's okay for you to have caffeine. Circulatory and respiratory system. Caffeine is absorbed from your stomach. It reaches its highest levels in your bloodstream within an hour or two. Caffeine can make your blood pressure go up for a short time. This effect is thought to be attributed to either an increase in adrenaline or a temporary block on the hormones that naturally widen your arteries. In most people, There is no longer term effect on blood pressure, but if you have irregular heart rhythms, caffeine may make your heart work harder. If you have high blood pressure, hypertension, or heart related problem, ask your doctor if caffeine is safe for you to consume. An overdose of caffeine may cause rapid or irregular heartbeat and breathing trouble. In rare cases, caffeine overdose can result in death due to the convulsions or irregular heartbeat. Skeletal and muscular system. Caffeine in large amount may interfere with absorption and metabolism of calcium. This can contribute to bone thinning, osteoporosis. If you consume too much caffeine may cause also your muscles to twitch. If experiencing caffeine withdrawal or symptom may include any muscles reproductive system. Caffeine travels within the bloodstream and crosses into the placenta. Since it's a stimulant, it can cause your baby's heart rate and metabolism to increase. Too much caffeine can also cause slow fetal growth and increase risk of miscarriage. In most cases, a little caffeine is safe during pregnancy. According to the Mayo Clinic, you should limit caffeine consumption between 200 and 300 milligrams per day if you are get pregnant. There are some evidence that large amount of caffeine can interfere with the estrogen production and metabolism needed to convince. So here's the effect of caffeine on your body.